Call the meeting to order. And you all received the minutes. Are there any additions or corrections?
I'll make a motion to approve.
Is there a second?
Second.
All in favor?
Aye.
Opposed? Minutes are approved. On to the health officer's report.
Okay, hello, welcome. All right, so to start with local trends, COVID rates are increasing statewide. Just from my personal experience, we are seeing more, but still seems to be fairly mild compared to the past, for sure. Influenza-like illness is hitting a peak. We talked about that last month, that we expected it, and it is here. The peak is higher. This one is bigger than the time that occurred this time last year in 23-24, but lower than in 22-23. They are seeing some deaths from influenza statewide, so please be careful and keep yourself safe. We also know that we are seeing some norovirus, which is more of like a stomach bug, so like vomiting and diarrhea. We don't test for that routinely if you come into the ER or the urgent care, but we know from the state that we're seeing increases in that. That really mostly is manageable at home and is mild unless you are finding that you're becoming dehydrated. So you would know that if you were getting lightheaded or passing out or having decreased urine output, or in a child having decreased wet diapers. So if you have concerns about that, you likely need to seek care. If it is just nausea and you're tolerating fluids and it's mild but you want something for those symptoms, urgent care or primary care might be good. But if you really think you're getting dehydrated, passing out, that decreased urine output, you likely need to go to the ER. The care is really symptomatic, IV fluids, nausea control, that kind of thing. So do what you can to stay safe. For norovirus, the best prevention is hand washing, soap and water. Hand sanitizer doesn't work as well with norovirus as it does for COVID and flu. I would still recommend you use that, but good old hand washing is the way to prevent that. Stay home when you're sick to avoid spreading it to others, because we're seeing high levels of all kinds of viruses. So whatever you can do to keep your friends and family safe. And if you are suffering from norovirus, when you're going to clean up and whatnot, hot water for your clothes and linens will help with that. With all of these viruses around, I thought a useful thing to do today would be to talk about when it's useful to go to the ER versus the urgent care. I'm an emergency physician, and I also work in the urgent care system as well. Your ER is really for your severe symptoms. So if you're having something that's life or limb threatening or really concerning, so shortness of breath, chest pain, severe abdominal pain, passing out, confusion, stroke-like symptoms, numbness, weakness, loss of vision, difficulty with speech or swallow, those kinds of things. Major injury or trauma, like you've been involved in a bad car accident or you've had a fall from a high height. You have a bone sticking out. You need to come see us, that kind of thing. If your symptoms are more mild, then the urgent care is your friend. You've got that cough that just kind of won't go away that you want to get checked. You have sore throat, nasal congestion. You have some urinary symptoms. You've had a minor injury, sprains, strains. You don't know if something is broken, but you want to get it checked. The urgent care can help you with that. Maybe you think you have a viral illness, COVID or flu, and you're not that sick yet, but you have a significant comorbid disease like diabetes, or you just have a lot of other medical problems and you think you might need those antiviral medications like Paxlovid for COVID or Tamiflu for influenza. Those work best if you start them early. So you've got 5 days to start Paxlovid, and really Tamiflu works best if you start it in the first 2 to 3 days. So in that situation, you may need to seek care earlier, even though you're not that sick. And in that case, the urgent care can really offer you that viral testing and make recommendations regarding those medications. Your primary care office can do that as well. Also, sometimes it can be hard to get in. That's worth a shot as well. So the ER has X-ray, but also has more advanced imaging, like CAT scanners and in some cases ultrasound and MRI. They have all the labs you would need in an urgent scenario, so blood work, urine, swabs, access to inpatient care should you need to be hospitalized, and subspecialist support. Now the urgent care has X-ray, right? But they don't have that more advanced imaging. They have viral testing, strep testing, urine and urine pregnancy tests, but they don't have the full panel of blood work that you might need in certain scenarios. So just keep those differences in mind when you choose. It can be helpful to make the right choice, both to help you access care faster. I mean, if you've been to the ER or the urgent care in the last month or so, you know it's really busy. So choosing right before you go sometimes can help you get care faster, and it can also keep the system from being too overloaded. I also, as promised last month, want to provide you some insight into our key performance indicators for the health department that are provided by the State Department of Health. And this month I want to talk about infectious disease surveillance and prevention and immunizations. So one of the services that we provide to the community is communicable disease reporting. We report that to the state and then also help with any investigation that may need to be done. We also do a fair amount of STI, or sexually transmitted infection testing. So this is done at the health department. It is low cost, or in some cases no cost. They can test you for HIV, hepatitis C, syphilis, gonorrhea, chlamydia, all of those. We also collaborate with organizations to provide testing and really take the testing to the patient, to where they might be. One example would be how we collaborate with local universities to provide testing to students. There's been a little bit of gap in that as we have transitioned from the previous health officer and advanced practice provider over to myself and POSHA, but we are really revving that back up and looking to expand and do more outreach to provide that testing. Now, we don't do sick visits and we don't test for COVID and flu. Now, in the past, the health department did a fair amount of COVID testing. We don't offer that anymore at the health department, but you can certainly access that through the other urgent care, primary care, and emergency departments. We also have a very robust immunization program. So the health department can provide you with vaccines against influenza and COVID and childhood vaccines. We also, while we provide these immunizations and vaccines at the health department, do outreach through community events, school clinics, nursing homes, business, other community events, or community centers, and more. So we're really trying to protect the community and meet them where they're at. I would say one last thing. Flu season goes from October through the end of March. So if you've not had your flu vaccine, it is not too late. It can still protect you from the second peak that we'll see later this season. So that was maybe a little bit longer than my previous reports. I'm not signaling that I'm going to make these longer in the future. I just won't be here next month, so I'll give you a double dose. And with that, I'll hand it off to Dana, unless there are any questions.
Very helpful and informative. Thank you.
Sure.
Any questions before we move on?
So it's on the rise right now, so what has that done to the hospital levels?
Well, I don't know that I can give you actual admission levels right now, but I can tell you
Just
that the
not like
hospital
that.
is very, very busy. Yeah, the emergency department has been super busy lately. The urgent cares are very busy. And I think that's part of the reason why it's useful to try to choose the right place. You can't always make the right choice, and it's hard to know. It's not easy. But if you end up in the wrong location for care, we'll get you to the right place. Either way.
Yeah, every term someone's sick,
Mm-hmm.
you can just tell.
Yeah.
Okay, going to the Director of Clinical Services report.
Right. Well, this will actually be a great spin-off from what Dr. Bales mentioned. Just to give you some numbers for last year, vaccines provided, we actually provided 2,838 vaccines during the year 2024. Of those, 662 were under the state program, so that's underinsured, uninsured, and Medicaid eligible. During the 2024 year, we did 40 off-site clinics, not including our guaranteed. Every month we go to Hagerstown and Cambridge, so that's not including those. So each month we'll hit those two places, and then we did 40 outside of that, and that is with a very decent gap in providing services through our providers. So we are currently open Mondays until 7 to make sure we can accommodate anybody after work, and then the first Saturday of each month. Going forward for this upcoming year, we're looking at a new location possibly for Cambridge City. Currently, we are at the goal 8 from 1 to 5. It's really not convenient for school or work, so we're looking at potentially partnering either of an evening or a weekend with another facility that's also doing community outreach to see if we can hit more on that front. Looking at our STI testing, we are actively promoting that again. We've had a pickup in visits for that. We'll go to BSU twice a month, and then we're also partnering with the local Ivy Tech, IUs, or any of our local colleges as well. And then on the STI side, we're actually looking to partner with some local communities as well who cannot offer those services based on size or staffing. So that would allow us to provide those as well. With the staff we currently have, it wouldn't take away from what we're providing to Wayne County. It would just help out another partnering community. Let's see. Continuing education, we're right now hitting really hard with trying to get all of our staff back up to where they need to be with some of the turnover, and then making sure we have our annual training. So we're working on annual STI training, vaccine training, and then we're getting ready to do some off-site training opportunities as well in those same arenas, as well as having our new nurse practitioner do some shadowing at another health department they literally offer the exact same things we do. So that's going to be a good opportunity for her to kind of see how they flow. I'm also going there tomorrow from the back end to kind of see what some of their programs are and if we can incorporate any of those. And then just a quick update to try to let you know kind of how we're doing with promoting and social media. And I think Dan's going to hit on our website, but just with our social media, we're up 57% in our views. We've reached 70% higher in the last 28 days, and we're getting 3,000% more on our links. So when I'm sharing a link to whether it be Indian Department of Health or other opportunities, everyone's taking advantage of those. So we're actually able to hit more of the community. So we're going to continue to work on that, promoting the clinics we have, hopefully potentially start doing some live Facebook when we're at community events just to try to get some more action, some activity on there. Try not to be so boring and health. Just
We're looking to jazz it up.
Yeah, we're looking to jazz it up. But we are getting some more following and some more shares, so that's beneficial. Just making sure everyone knows when we're in office and what we're doing and what we can provide. So, questions?
Comments, questions?
Oh, I did have one more, sorry. I wrote it to the side and I forgot. This month, we actually did have one positive pertussis case in Wayne County. That's the first one we've seen in a while.
What, positive of what?
Whooping cough.
Whooping cough.
Okay, sorry, I didn't hear that word.
Yeah, and that was not a school age, younger, but we did have the one positive, so just, that is out there too.
Okay, I think we have an introduction.
Yes. So I'm glad to introduce Chad Kircher. He's the Deputy Director of Environmental Services, and he started on December 30th of 2024 and has been going through training and learning and everything with the staff downstairs and progressing pretty quickly. So I'm going to have him give you a snapshot of kind of what goes on in the environmental side of the department every meeting, and he'll have a little bit to share with you today.
And could you tell us a little bit about yourself?
I'm originally from Arizona, but moved up here when I was in grade school, and then started with the county actually in 2008, worked here with the Sheriff's Department for just over 15 years. Retired there as a patrolman and a supervisor, then left, went to Indiana University, and then came here with the health department. And we live here in town. I'm married and have 5 kids, so I'm very, very busy. But in regards to the environmental report and then specifically food, January 31st is the last day for food permit renewals without having to pay the late fee. Late fee is paying 3 times as much. Next week, 2 of our inspectors will be getting standardized with the new food code that is going to be in place. They'll be doing that through the state, and they will actually be the first 2 inspectors in the state that will be standardized. And then in regards to septic, we are converting old septic records from paper to electronic. I think Dan started this back in 2023. We have done 1968 to 2004, so we are currently working 2005 to 21. Everything else is present. We already have turned over. And then in regard to the failed septics on Green Mountain Pike and Main Street in Williamsburg, Greenmount Pike, the contract and application are in place with Davis Excavating. We'll be checking back in March as they had 180 days from October to be in compliance. And then the residence on Main Street in Williamsburg, it is still in failure. It failed the dye test and needs to be replaced, and then the homeowners are not being compliant.
In that particular case, I don't know if that started prior to Chad or the homeowner. If you're not familiar with Williamsburg, they have very small lots inside the town of Williamsburg. The homeowner actually went out there with a spade shovel and dug up their whole trench. They only have one, and they dug it up, and now the sewage actually just seeps to the ground, so it's visible and all that stuff. They didn't even bother to cover it back up. So we're given an option, obviously to become compliant, and then if it progresses that they don't want to, then we'll ship it over to Chris to have him take a look at it.
And that'll be the end of my report, other than the tattoo and other issues.
Questions for Chad?
Thank you.
I'll move on to mine. The first thing I have is the health board roster. This has to be sent into the State Department of Health every year and needs the president and vice chair's signatures. And then once signed off, I'll shoot it off to the state. Health First Indiana. So I have brought Jason Chatwine here from Reed Hospital, and he's gracious enough to show up to explain Reed's proposed contract amendments. There's two different versions. I sent both versions out to the health board 3 or 4 weeks ago or so. And I've also included that into the packets if you want to try to follow along as Jason explains the things. Any questions before Jason steps up? Floor is yours. Yes, sir. Just start up here in the chair.
Hello, everyone. As I mentioned informally over there, your Jess Sheebish, who is the Director of Community Health and Engagement at Reed, is actually at Indiana Tobacco Prevention Cessation meeting at the state right now, which is where her time is best utilized, which means you're all stuck with it. And so I'm going to go through this the best way I can, and Jess has coached me. So we appreciate the partnership that we have with the Wayne County Health Department through the Health First Indiana program.
These contracts are in between pages 10 and 16 of your packet, and 17 and 22. The first version is 10 to 16, the second version is 17 to 22.
Dan, are you, is the first one in their packet, the $30,000 request?
I think it's the smaller of the two.
Okay, great. All right, perfect. Okay. All right, so as I mentioned, we appreciate the partnership with Wayne County Health Department through the Health First Indiana program. I think we're doing some really great work together. Just a little bit of an update. As we entered into this process, we have 2 community health workers. One is certified community health worker, that's Andrew Hoover, and the other is actually Shepherd. So they're kind of boots on the ground here in Wayne County who are trying to implement the programs that we put forth through our indicators that we call home. So that's what the current funding is really working toward, and I think we're making a lot of progress with that. This proposal is an amendment to that, essentially. And so, as Dan mentioned, this is 2 different versions of it. The first version is a $30,000 request for funding. And essentially, the gist of this one is to help us hire a lactation prenatal education consultant that would essentially help to provide prenatal fitness for about 20 expectant mothers throughout the year. So this would speak to one of our health indicators from a maternal and children's health perspective. The staff member would be Kim Riggs, and essentially, so if I kind of walk you through this, would it be helpful if I just walk you through an order of the proposal versus highlighting it? How would you like for me to share it?
Whatever you're comfortable with.
Okay, well, maybe I'll just do it that way. So on page 1 of this request, you'll see that the overall request is $30,693.56. It checks the boxes for tobacco prevention, cessation, chronic disease, trauma, fatality prevention, and specifically maternal and children's health. The budget request is asking for an increase in community health workers' annual rate and salary. This is actually for a cost of living increase. Okay? Okay, so every Reed employee this year will receive a cost of living increase, nearly every employee. And what we're hopeful is we want to retain these community health workers. So Andrew and Ashley specifically, if throughout the process, throughout the years, if we're not increasing their salary, we're at risk of losing them. We'd like to try to keep them whole for team. And so this is essentially to do that. And that would be the 2820 for each one of those. That's a 3%. Actually, it's a 4% increase for them. And then the $17,000 part of that request is for the lactation prenatal education consultant that I just mentioned. That would be a $43.46 per hour wage. That is that person's current rate, and it would allow them to provide about 7.5 hours a week for the classes for prenatal parents. We can go. I don't know if it's necessary. Do you want me to go through all the different deliverables, or you just want me to overview?
I can overview and then open it to questions.
Okay.
All right, people can ask questions if they want.
Thanks, Dr.
More
Evans.
detail.
So we'll skip through to page 4 of this specific piece, and that takes you to the fringe benefits. So there will be a slight increase in the fringe benefits because the salary is increasing, so that is about $900 in total for those 2 community health workers. And we're also requesting that we fund cell phones for those 2 employees. And here's the reason. What's happening is a lot of times these community health workers, so Andrew and Ashley, they're out in the field and they're trying to work with individuals. A lot of the work that they're doing is following up, helping to answer questions, helping to go to a visit, helping walk them, take them someplace. The community health workers are doing their jobs best when they're not in the office, which means that they're mobile, which means they need to be able to answer the phone for these folks that they're helping. What we're trying to do is make it so that they're not using their personal cell phone, so that they do have a little bit of separation of work and life balance, so that they're not getting these calls on their personal phones. So these really truly become work phones, mobile phones, that they're able to call out. I encounter that in some of my own work. For example, right now we're going through a lot of Medicare Advantage changes. I don't typically like to use my personal cell phone to call a patient and talk to them about their changes, because otherwise that means I'm going to get calls candidly 4 or 5 times on a Saturday night, and that's not necessarily ideal. Okay. So that's the reason for the mobile phone. The next page is for training. So this would be training for the staff, but also marketing and outreach and class supplies and equipment for the prenatal class that we're talking about. Okay. And that rolls up to the $30,000. $693.56 request, which is part of proposal 1. We're going to move on to proposal 2, so that way you have a comparison. I can do that.
And proposal 2 is basically combining proposal 1 with and the main gut of 2 is adding another healthcare.
That is true, yeah. So it's exactly everything from proposal 1 with the addition of a 3rd community health worker and all the things that would trigger because of that. So a 3rd community health worker, their salary, their fringe, a computer, a phone, training. So that altogether, that's the difference. Essentially, that's the difference in 30,000 versus 96,000. And that 3rd community health worker would allow us to see more people and work toward our indicators quickly.
One thing that I noticed, which I was encouraged to see, is it looks like you're using them as navigators also, which I think is very important, particularly on the chronic health side of things.
And to the point where they've even helped in some of the, just with access, Dr. Ryder, just when they're having trouble getting to an appointment, or maybe helping from a health literacy perspective, they don't understand the next steps or what they need to do. So yeah, we're using them in that way a lot, but also helping them direct them to resources, for example, Quit Now or whatever it might be. So they're also going out and doing some things in the field. For example, I think they were here recently with you, all of you. I was over in Cambridge City. Yeah, we were actually doing some was it sugar? Was it? Were they doing? They were doing finger sticks, I think.
It was our mobile clinic at the building.
questions? And I think that the difference between the two is one is adding a third community health worker. The other is basically, except for an addition of somebody in the perinatal or prenatal area, is kind of a housekeeping thing for a salary adjustment, keeping pace with the hospital, rest of the hospital staff.
So, and I've obviously read through both of them a few times and had conversations with Jess and Eric Reed. And then I've also posed the question, depending on which version, if the board approves either version, how that would affect 25's Health First Indiana budget. So I gave the board the breakdown on that and what would be left over if either one of these amendments was approved. From what I've dealt with now, I've dealt with all 6 partners for approximately, give or take, 6 months with reporting, invoicing, things of that nature. And Reed is very compliant with what they do. They invoice well and they report numbers very well. So I would not have a problem at all going with the larger proposal. It's putting those out there. We've been through a couple of events and they also joined some of our events. And as a combination, we make a pretty good team.
If I could just for a second, one thing that's really great about this partnership is that many of the indicators that are part of the Health First Indiana and specific to our county are the same indicators that have been highlighted in our community health needs assessment that we conduct every 3 years. Just for awareness, this is the last year of our implementation plan from the 2022 needs assessment. So we'll actually be going through a new community health needs assessment in 2025 that will create an implementation plan for 26, 27, and 28. Obviously, we're going to be working very, very closely together with the health department because we're best when we're aligned on those indicators and all rolling in the same direction. And I think that this funding and the way that we're working together is really going to help our community out as we look forward, right? We're not going to be competing, but we're instead we're going to be collaborating a lot.
Does anyone have any questions on the money part of things?
I actually have a question before the money. So you have the lactation and perinatal education consultant, so how does that align with what the OBGYN is already doing? And mother baby and all that.
That's a good question. Yeah, I'm not sure that I know specifically, but my assumption is that, obviously they have some classes there, but this I think is taken into a different level, and this will be something that it's more an ongoing process. And I believe that Kim also helps to identify some of the parents who maybe really need some extra resources, and I think she's helping direct them where they might need to go. And there's also a level of accountability here, since they're part of this class ongoing. I think that's part of the idea as well. So I don't know how it necessarily, I think it works in tandem with what they're doing at OBGYN. I'm sure it does. I don't know what the overall overlap might be. Sorry, I can't answer.
No, so it's more building off of it, not making new things.
Oh, no, it's completely complementary. Yeah.
So with that said, when the board makes their decision, hopefully today, we take whichever contract amendment has been approved and we post that for 30 days for State Department of Health's requirements. Then after that 30 days is when it becomes official and requires signatures.
So the way I view it, there's 3 components that really include, if we just look at the amended second contract, it has all 3 components that we need to decide on. One component, frankly, is just a salary adjustment to keep pace with the times. The second component is the prenatal assistance. And the third component is the additional community health worker, which I personally think is very important, particularly on the chronic disease prevention side, because they bring in navigating. So we could divide it into the 3 components. I think we would have that ability to say, on all three. Or we could take the second one just in whole. Whichever the board's preferred.
Dan, you said you're comfortable with the increase?
I'm comfortable with taking the second amendment in full. As far as money goes, budgetary wise, I'm comfortable with it because I'm 99.9% sure they're going to approve my carryover request. So that would leave us with the option 2 at the bottom of the page. That would still leave me $242,000 and $828 left in the contractual line, even if we pay this in full.
And I would like to point out some informal meetings that Dr. Jetmore and I and some others had a few months ago. We actually encouraged Reed to consider adding more of a navigator type status at that time. And so I think it's partially in response to that, to our request.
When do we know if the carryover is going to happen?
Within a week or two. I spoke to April Kindred, she's the finance manager for Health First Indiana, on Friday, and she said she didn't see any issues at all with the room. So it's just a matter of going through the rules of motion. We have the money. It's our money, so we have that money left over. It's just a matter of how it's appropriated, what the city approves. So, and they're in favor of creating partnerships with that money. It's kind of what Health First Indiana was designed for.
Could we approve number 2 with the condition that the money does get carried over?
Contingent upon that?
Which means there's a 99% chance this is going to work. I like those odds.
I'm confident. Very confident. So are you making a
what's-
motion then to?
I'm
approve
just
the second
asking,
one?
just
Okay.
pure.
So is the motion to approve the second?
I would feel comfortable approving option 2 as it is, as long as the money rolls over. Because as soon as we approve it, I know what's going to happen. Something's going to happen, then the $92,000 turns to 0.
So
Not on Reed or anybody else. It's just the way the world it seems.
he's suggesting a motion of approval of Amendment 2 on conditions that the State Department of Health approves the carryover request that I submitted.
Is there a second?
I second that.
Further questions? All in favor? Aye. Opposed? Thank you.
Does that
Thank
make
you very
sense,
much.
Jason?
Yeah, it does, and that'll give us some time to start our process, and then if we need to pull it back, hopefully we don't, if we do, we could. It's specifically on the third community health worker. And it'll take us some time, obviously, with the classes to build the marketing for that, make sure they have the structure. So that gives us some time, and then we'll just wait and hear from you. If we need to pull it back, we will. Hopefully we don't, and we're able to move forward.
On my end, I will go ahead and post it on our local website, waynecountyhealth.in.gov, to start that 30-day kickoff. And we'll have the approval or denial from the state within that 30-day time frame as far as my carry request goes over. So we'll be able to implement and sign hopefully in the next health board meeting.
Thank you all very much.
Thank you.
We do appreciate the partnership. It's been great. Thank you.
Okay, Centerstone MOU for vaccines.
Yeah, so Centerstone introduced a MOU for vaccines that they could not provide under what we call the 317 program that Beth explained earlier, which is for people with lower incomes that are indigent, Medicaid, so forth, so on. So I had them make some revisions in that MOU to better suit us as a health department, and then I kicked it off to Chris to have him review it from the legal standpoint. He suggested a couple edits to it, so I've sent it back to Centerstone for those revisions. So we'll hopefully be voting on that next House board meeting.
My question is, why do we need that? Why can't they just directly send the people to our fund?
Kind of asked the same question, and they said they'd prefer to have an MOU, that way we won't turn anyone away. And I said we wouldn't turn anyone away. I mean, it's not what we do, but if it makes them feel better, I don't have a problem with it.
It's more like a statement of the obvious.
Yeah, I agree. And then the next one is the Stride Center MOU. Has the board had time to review that one?
That's on page 8.
Page 8, I'm sorry, when I did edited the header, some of the pages got out of line. Should be page, if it matches mine, should be page 8 through 12, or 8 through 11, sorry. And this is the partnership that has been talked about for a very long time now, and actually set to open 2 weeks.
Yeah, February 14th will be the opening for the public. We are hosting a grand opening on February 13th, from noon until 2. Speakers start at 12:15. We'll be scheduling alternate tours as well for folks that cannot come to the open house, and ribbon cutting. Yeah, I'm trying, what other questions or information are you guys wondering about?
So the commissioners have already approved this, or
They have not approved it. I mean, they've been in the discussions part of it, and I think they agree with this 100%, so.
our part is because we're using
Health First Indiana.
Health First Indiana money,
Correct.
is the reason we're being,
Is there a reason why?
that's the reason we're involved.
Correct. So they've offered, we used to run this through the fire department, and the fire department kind of bowed out. And Centerstone's actually expanding on what the fire department did do with the Stride Center.
So
So
we funded the fire department.
yes. So Centerstone is actually making this program more robust than what it used to be.
So it's a continuing program that's already been in existence and to improve it.
Under a different title name, but essentially the same functions.
Probably not.
This is something that we most definitely need in the community. This will help keep people out of jail. It will provide, quicker routes to treatment, housing, several other things, mental health related issues and substance abuse related issues. So it is something that our county desperately needs, and it would help hopefully lower some of our numbers on the death mortality rate and things like that in our county.
Amanda, I think you have to recuse yourself.
Yes, do I need to leave? Yes? No, I just need to stay silent.
Chris, if you had time to review this as well.
I've only briefly reviewed it, so I wouldn't be comfortable right now giving you an opinion or giving the board an opinion on it. I would certainly be by the next meeting. Let's go around that.
So we'll put table it essentially until next meeting, until Chris has
Or
time.
table it until
Yeah.
next time.
Are there any questions on it, I guess, before next meeting?
I guess while Chris is reviewing it, I think those of you who reviewed this copy, do you have any questions that you want Chris to look at that you're concerned about?
Yeah, no question.
Okay.
It meets the requirements for Health First Indiana as far as the invoicing and reporting functions. I can tell you that. And it's nice and short, which I like.
You're ready for help.
Yeah, so I had Health First Indiana, really the only thing I had on that was the contracts. We've discussed all the time, so KPIs, we're moving along with the KPIs as designed and on what we had submitted to the state. Our health officer was mentioning in a state Department of Health meeting this morning and was praised for her actions at the emergency room. So, congratulations.
Thanks.
So we're in good standing with the state when it comes to Health First Indiana and our KPIs. I did want to follow up with Chris on the contract termination.
So I've sent off a couple of requests for information, haven't received anything back. I'm at this point, because I haven't received anything back, I'm not confident that they're getting to the right people. So I do want to send off a certified letter kind of stating the department's position, asking them to provide funding to return the equipment and to verify that they're terminating the contract. I think there's a strong, very strong legal justification that there's no valid contract, which is why I had initially advised you against terminating the contract under their terms, because that essentially acknowledges that there's a valid contract in place, and I don't believe that's the case because of the way it got approved or didn't get approved, as the case may be. So that's where we are now. I've drafted that. I've got a draft of the letter, but I want to work that with you before we send that out, get that sent off to them so they essentially have to respond. And take it from there.
And what we're talking about, if you don't remember, last board meeting, we discussed some machinery that we were, was entered into a contract with that we don't believe was a legal binding contract due to the way it was entered into. We're trying to return those machines and hopefully recoup some of our money. And that's what Chris is working on. That's what we were just referring to. We've posted the public health nurse position in Western Wayne. We've had it on Kicks 96, and it's obviously been on the county's website, our Facebook page, the county's Facebook page. We had 3 applicants. One's already dropped out. We have 2 interviews set for this Friday, so hopefully those hold fast. I'm still going to continue the advertisement in Western Wayne. I'm going to let that ad run out at least to see if we get any more applicants. But as of right now, we have 2 interviews set for Friday. And then the next thing we move on to is the 340B consultant proposals, if the board had time to review those. And both proposals were robust. My recommended proposal is the NELCO proposal, which starts on,
Because it was short.
because it was short, right,
41.
page 41. So, and the reason I like this is the first one through CPS, they offered a lot of the same things that NELCO is offering, but what the difference is they want a percentage. So every time that prescription is sent off to the pharmacy, they want a percentage of our profit every year. Not just the money that you charge us up front to provide the services, but then a percentage based off how many patients we see and prescribe medication to. Whereas NELCO is just a flat rate. And that rate is on page 45. So they're going to offer their services to us for $2,500 a month. And that's 5 hours of anytime consulting with Dr. Bales, POSHA, or anybody there at the health department. And any additional hours past that 5 is $350, which is a 30% discount, so they say. And then the next one is $12,500 for the annual audit. And this is what keeps us compliant with HRSA, to make sure this is for me probably the biggest part of this consulting that we need to see where we stand with the programming, what kind of compliance we have, what kind of compliance we need. They will help us do that. They'll do this audit, and then come back and tell us what we're lacking of or what we're good at. And that will allow us to better direct which kind of procedures or policies that we need to start drafting, or maybe even how to better operate the program. And the $2,500 a month would be super beneficial, since our whole administrative staff, including the health officers, knew none of us are very familiar with the 340B program. So it'd be nice to have that call a friend option, in a sense, when we're dealing with 340B. So if I did the math right, I think that totals up to $43,000 for a year, is what it boils down to. And that's just the flat rate. There's no percentages. They don't take anything off the top.
That's a 3-year contract.
Correct. Yeah. So put it in perspective, last year we took in, I think, $1.6 million in 340B, and we went with essentially 3 months of no service. So.
And I think it's important because there's federal audits and making sure you're in federal compliance.
If we don't, HRSA could actually make us pay money back. So definitely want to agree with that.
And with this CPS proposal, what are we, I mean, it would be hard based on their lane portion.
Yeah, so they're going to have a flat rate for the audit,
Yeah,
and then
which is higher than Melco.
Melco, and then they're also going to have, I can find it on the page here.
39.
Yes. So the monitoring is $7,500 per month. That's for 3 years. And the compliance audit is $18,600. So they're $6,000 more than what Echo just for the annual audit. I'm trying to find and then here it is, the 340B ESP assistance, 20% of net financial improvements for 3 years. So not only are we paying more for the audit, more per year for the consulting, we also have to pay that 20%.
And you said both of these companies have worked with the state health department.
Yes. Both these companies were referred to me from the state Department of Health.
But I don't think they've worked with health departments before, right? Not what we discussed. They were referred to us by the state, but have not consulted with health departments before.
Correct. Yeah, they have not. Right.
So they were referred to us by the State Department of Health as options, but they have not worked with health departments specifically.
Either one of them? So they're really designed more for hospitals and clinics, or?
State Department of Health, pharmacies, hospitals, larger operations. But the 340B is 340B, whether it's with us or a hospital or it doesn't matter where it's at, it's still 340B.
Now, the CPS looks like it's geared for pretty big operations, much bigger than what we are.
We also did talk to the pharmacies that we use for 340B, and they looked at these and did think that Melco would be sufficient for what
Are
we
they
needed.
familiar with either one of them, the pharmacies? Don't they know?
No, they weren't familiar with the companies, but they were able to review it and say, yeah, this is what you will need.
So we met with Medicenter, and those are the pharmacists that's who we have a contract with. They reviewed this, and then we're going to have a meeting with Phillips Drugs as well, because we have a contract with them on 340. But these are merely proposals. So what I'm asking the board for today is to choose a proposal, and then they'll shoot over an official contract, and we'll bring it back to the board and the commissioners. Is there anything in this proposal that you've seen that you would like modified, or have questions about that I've not answered that they can answer?
So any training that you would want from them, that would come out of that $2,500 a
That would be
month?
the 5 hours a month. Yeah, the training that we want. And we basically said anything under this $2,500 or that 5 hours would include anything we wanted, question-wise, training-wise, anything that we wanted other than the audit itself.
And you thought that would be adequate?
I can't answer that. I don't know if it'll be adequate or not until we get into it. But yeah, I can't answer that question. I just don't know. he seems to think it was adequate. The pharmacist that I spoke to on the phone, which was Joshua Free, which is on the top there on page 48, is who had the consultation with for our format. We're not dealing with hundreds of patients a month, like a hospital would be or something like that. It's a lot smaller.
So between the two options, is there people's opinion on the two options?
Well, I guess if the deliverables are the same in terms of what they're gonna provide, then to me, it comes down to money. That's kind of no-brainer there.
And for me, it's hard to explain to a board too, but after having consultations with both companies, this company is more personal, where the other one was more, you could tell they were trying to make money, where this guy wanted to truly educate. That's the way I took it, at least after speaking to both companies.
Other questions? I entertain a motion.
Make a motion for Nelco.
I'll second that.
Further discussion? All in favor? Aye. Opposed?
All right, so I'll get a hold of them and have them draft a contract for the board and Chris to review. So we have started with the credentialing process through our company, third party through our EMR, Athena, the company that is doing the certifications is certifies the name of the company. We're getting close on that. We're working through some documentation I need from the county, from different offices, so I'm working with those department heads to try to obtain that documentation. And once we have that documentation, we'll be close to that 100% mark of having everything we need to move forward with both Dr. Bells and Posha. We are sitting on, 6 claims, 8 claims, 10, somewhere right now that they're put on hold because there's a lot more. Because our practitioners aren't credentialed at this point. So we also had to write off $63,000 worth of claims over the last 2 years, 3 years.
Yes, around
Because the practitioners weren't credentialed. So
prior practitioners.
practitioners.
Have not
So
initiated their
this
credentialing.
process is very important so we can get our reimbursement from the payers. We deal with approximately 15 insurance companies. And I'd say we get denied or we're placed on hold or there's problems with the claims on over half of them every time due to this credentialing. So we're getting closer. We did start the billboard campaign last month or whenever it was. And we had internet numbers. The main reason for those billboards was to notify the public and drive them towards our website for information. And if you look at last November, I provided to the board last November, we had approximately 2,470 individuals or clicks on our website. We've done some updates to it with the billboards for the month of December. We've increased it by right at 100. So we've had 100 more visits, and we hope to continually climb. I've edited the website several different times. It's, in my opinion, very user-friendly. It has the Facebook link on top now. It has links to anything you need from CDC travel to a birth certificate application. As soon as you pop open the screen, it's all right there in front of you. You don't have to go search for it. So I'm hoping that the advertisements and things drive them to that website and brings in more patients. Laptops, I'm about to replace the laptops in the health department. Mine completely crashed with the last Microsoft update, so I don't have one right now. But we'd be broadcasting this on the screen instead of 1,900 pieces of paper. So I'm working on that right now. I'm waiting for an employee of the auditor's office, and once they return to work, then I can move forward with that purchase. And it's all spec'd out from our IT department. It's everything about them is what they've requested these laptops have, so there'd be no issue there. And then we had a conversation with Union County last week. They want us to help with their lead risk assessments and clearance testing. So they don't have the staff nor the Health First Indiana funding like we do to pay someone to be a lead risk assessor and clearance tester. So we're working out an MOU with them. I have them drafting it. Essentially what that MOU would look like would be that we would respond to a lead house there if a child tests positive under the age of 6. We would respond to that person's home. We would provide a lead risk assessment, going in using the XRF, the ghost wipes, physically assess the property, find out what the lead levels are. And then we would pass those all to Union County, and Union County would write the recommendations or the abatement orders. We would not do any type of orders or enforcement in Union County. They would also provide all the lead education through their public health nurse, so we would not be providing that. And if the abatement order was compliant, then we would return to Wayne Park to Union County and provide the clearance test for that particular property. With that said, I've asked that Union County reimburse us for our labor, our vehicle fuel, supplies, all that good stuff, which came out to approximately $300 per risk assessment and $300 per closure. Private industry charges about $750. So we're going to make a little money, but not a whole lot. I didn't want to make a profit off this. I just wanted to help Union County out. But we won't lose any money. We'll be reimbursed for anything that we put out there. Does the board have any suggestions or comments?
What are they currently doing?
Nothing. Yeah. So if they do have a child test positive, they usually have the parent hire a company, or they rely on the State Department of Health for one of their lead risk assessors to come in, which they are months behind. And that is a KPI. I mean, they have to have something to be compliant with their Health First Indiana funding, period. Just like up here, you don't necessarily have to do it yourself, but it has to be done within the county. And I think that is all I have. No, I got two more, sorry. I don't let you guys go. The tattoo, standard operating procedure, and eyelash extension, the standard operating procedure. You should have copies of those as well in your packet. And if everyone had, I think I sent those out a couple weeks ago as well, so everyone had time to review them and what's their thoughts.
The only question I have is that you said you would retain records for 2 years. Is that enough?
We would retain records for a lifetime because they'll be digitized. So any complaint that we receive, that's what required by the state. So that's why it's in there. But we'll keep them for a lifetime, just like the septic records and everything else digitized. And that's, right now, it's just going to be complaint response only, which is what the Health First Indiana requirement is. It's not compliance inspections, it's not permitting anything like it. It's only if somebody calls and complains, we respond to that complaint. But yes, we'll maintain those records for a lifetime.
Any questions, comments? Anything in a motion to approve?
So moved.
Second.
Other questions? All in favor? Aye. Opposed?
I believe that is all I have. Unless the board has questions for me.
So next meeting,
February 11th.
anybody have problems with that date? Okay. Any other questions, comments? Anything, a motion to adjourn?
I just had a question. It's just like a follow-up to what you say today, maybe next month, just to highlight where we are in needles since we've switched. So now it'll be
To
what,
100.
3 months in.
You're talking about the numbers?
The syringe.
The syringe exchange, yeah.
So it's leveled off as far as the participants go, if I'm not mistaken. You probably know more about this than what I would at this point, but it's not hurt us as far as participation goes. We're still up to those same numbers.
We saw an increase in participants when they weren't collecting for everybody, and then now we're about the same. We're just kind of,
Maybe next month, we
Understand.
can just do a report on.
Yeah, absolutely. We'll bring those.
But I think the last I heard, continuing to receive more syringes than what is
we're
given
giving out,
given
yeah,
out.
we are getting more back than we're giving out.
And two, we have started testing back with SSB, so now that we have OSHA in place, Gennaro's went out and started testing as well.
Mhm.
Other questions? Motion to adjourn.
I'll make a motion to adjourn.
I'll second that.
All in favor?
Aye.
Opposed? Thank you, everyone.